Is facial symmetry important? And what about the golden ratio? Facial symmetry and facial proportions are things that I hear a lot about in my practice. I see a lot of patients, especially younger female patients, who can become quite obsessive about very minor asymmetries in their face. 500 years ago, this guy you may have heard of called Leonardo da Vinci came up with what have now been adopted as the laws of beauty. The laws that Da Vinci came up with focused on symmetry and this proportion that he described as the golden ratio. Ever since then, people who are interested in beauty and some doctors in aesthetic medicine has sort of become a little bit obsessed by it. I'm often at medical conferences where doctors will get up on the stage and they will come out with their sets of calipers and they will measure the angles of the patient's face and tell them what's wrong mathematically with their face. And I don't think that's the way we should be approaching aesthetic medicine for so many different reasons. Beauty is when someone or something just pleases all of your senses and makes you instantly drawn towards them. It's the way they move, it's the way they interact with people, it's the way they exude a warmth that draws you towards them, it's the way they smell. There are so many more facets, if you like, towards beauty. But when you find a truly beautiful person, you will find that their face is rarely symmetrical and very rarely do their facial proportions conform with the golden ratio. By sticking to this rigid set of rules, I think a lot of doctors are homogenizing the way people look. When you look at the young generation of models today, you will see that they all look remarkably similar. Most of these young women are already very beautiful, but they are starting out at a vulnerable stage in their career in modelling, which is notoriously tough. And they go and see the doctor who gets out the calipers, tells them what's physically wrong with them. And actually, what most of them really need is some strong reassurance. If we have a look back at the supermodels that were popular in the 1990s, they all looked different. They all had their own distinct, unique looks in a way that you just don't see these days. If we take Claudia Schiffer, for example, who has to be one of the most beautiful women that has ever lived. But if she walked into a cosmetic doctor today, looking the way she did in the 90s, they would get out the set of calipers and they would tell her that her mid-face was underprojected and that she needed some cheek filler. And you know what? She would have ended up looking just like every other young model that we're seeing today. My advice is usually don't do it. Asymmetries in the face are not just caused by differences in volume, it's caused by differences in skin, muscle, fat, bone. Unless you were to identically replicate that on both sides, you're never going to achieve perfect symmetry. So you chase something with the techniques and modalities that we have available to us, and you never get to where you want to be, where you have that perfect symmetry, but you lose a bit of yourself and your own character along the way. You need to find the true character in your face and embrace it if you want to truly achieve facial beauty. Trying to find the character that exists in your face, work with it, minimize anything that you're uncomfortable with, if it's jowls or a bump in the nose or whatever it may be, minimize that for you. But it really is about ultimately achieving a really healthy, fresh complexion that looks like you and is completely unique to you. What I don't want for you is to look like every other girl that you see out there who has very clearly been to see a cosmetic doctor. Any questions or suggestions for future content, please pop them in the comment section and don't forget to like and subscribe to our channel.